Hi, it's Dr. Kevin. We had a comment asking for comments about fibroids and bleeding, so we're going to go over that today. Fibroids, it's all about location and size. So kind of like New York City real estate, it's your apartment's worth where your location is. So that's the same thing, is the problems from fibroids are where the location is. So we have three different fibroids. We have fibroids that are in the wall of the uterus but bulge into where your period comes from. So this is the uterus, this is the vagina, this is the cervix. Ones that bulge into the uterus are called submucous, and then ones that bulge into the outside or towards the abdominal wall, those are called subserosal, and then we have ones that are in the wall called intramural. So each one is a benign tumor. Fibroids are benign tumors of the wall of the uterus. They're super common. 60% of women have fibroids, but it depends where they are. Sometimes when they're more on the outside, they cause pressure and pain on your organs. Sometimes they could be really small, but just under where your period comes and cause lots of bleeding. The treatments for fibroids are divided in you wanting to retain fertility. So if you're a young woman and haven't had kids and want babies, there's completely different choices than if you don't want babies or you're done with childbearing. So that divide, if you want to still have babies, the treatments are limited to hormonal birth control pills, or we have now newer medicines like Myfembree or Arion, where we can lower your hormones but not put you into menopause. Or we have really strong medicines like Lupron to put you into menopause. We also have cleaning the DNC to sort of reset the system. If you no longer really want to have children, we have things that destroy the fibroids. But the problem is when you destroy the fibroids, you also partly destroy the wall of the uterus. So if you want the womb to hold a baby for 9 months, you don't want to destroy too much of the wall that the fibroid is in, because you want it to hold a baby. So those treatments are like embolization, the catheter in the groin. The interventional radiologist, the doctors in the hospital go right up to the fibroids and destroy the fibroids. We have ablation, we have destroying the period. Those don't affect the fibroids directly, but stop pain and bleeding. And then we have more surgical options like the hysterectomy and myomectomy. Myomectomy means take the fibroids out and rebuild the womb. The problem with rebuilding the womb is it's very painful for the patient. And in the future, you may grow new fibroids. So the myomectomy surgery is usually done for young women who want to keep having babies. The hysterectomy is usually chosen for women who are no longer want babies but don't want the fibroids anymore because it removes everything. So there's no chance for the fibroids to grow back. And also it's actually an easier recovery. So again, with fibroids, it's like, what are you feeling? Pain and bleeding, pressure? Is it affecting your ability to have babies? Is it affecting your ability to function? And also location.